So, Helen, how was your week?
My week was very good, thank you, as always. What have I done this week? Well, not a quiet week. It was the last week that my kids were in school, so it was the numerous activities that they like to really ram in right at the end. So like Thanksgiving, sports days, not Thanksgiving, prize giving.
Are you American?
It might throw that in as well. I could have missed that one. Yeah, all sorts. And then been watching the tennis today. I'll not give it. Oh no, no. Well, actually, everyone will know by the end. I was going to say everyone will know by the time this comes out, won't they? Bit of a shame, bit sad for me. I did want Djokovic to win
Why do you like Djokovic so much?
because he was so anti-vaccine.
Yeah, brilliant. Yeah.
Sorry, look, I'm all on personal choice, and he got treated really badly over that. I felt as an elite sports person, you should be able to make choices like that.
Yeah.
Without the vociferous dialogue that went on about what a horrible human being he must be for trying to make that choice. I think that was uncalled for at that point in time.
So there was no justice win for him today.
No, I think being something like 37 days out of NEOP.
Yeah.
Ooh.
Yeah. Amazing.
So,
Amazing.
and he kind of looked like it today.
Yeah. Well, maybe the first win of 2 for Spain today. Maybe
Yeah,
not.
Maybe.
Yeah.
So let's not jinx anything here. So, Ali, how was your week?
Yeah, I had a really good week, thank you. Yeah, it's been busy but good. Akash Maru started with us, and he saw his first patient in the building, and it was a really proud week for me because I worked with Ash in Hereford, and then I went back to mentor him when he was doing more implants, and now he's doing some work with us, and it was really nice because the reason he started working with us, he lives in Birmingham, so it's a long way for him to come to work here.
Oh, wow.
But it's really nice for us to have someone who works like us come here, and he's come to us for surgical experience, and to have a mentoring experience without having, I really don't want to drive around anymore. And it was really cool because we had a patient who had pain, root fracture, wobbly front tooth, really terrified of losing it. She came in to see him, and she was in at 10 o'clock, and by midday she left with a fixed tooth in place. So he took the tooth out, placed an implant, and put an immediate loaded crown on there. He used the tooth itself as a crown, converted it, but it was his first time immediate loading. So he didn't really need me for the first bit. I went in to show him the steps and the other bits which he knew about, but he had never done. And it was really nice because it was a really proud moment, but also we gave him skills that he can take away now without me having to go somewhere and without him having to pay for mentorship, which is awesome. So that was a big win and a big burden. That poor patient would have been waiting weeks to see me, and I was seeing patients, and he sorted this out. So it was a really nice step in the right direction for the practice as well. And then earlier today, Flo and myself were at a meeting with, it's a Sunday, and we went to a restaurant called Brother Thai, and it just makes me think of that meme that brother and that's just been playing in my head all day, and I'm walking around the house going brother every time I look at my calendar. But the point of the meeting was we're looking at implant maintenance plans and extending warranties based on patients actually maintaining their implants. But it was a really good way to do this, where we thought of this plan, we talked to our accountants about how to make it work, and instead of going ahead to implementation or just telling people what we're going to do, we had the clinicians that are heads of departments or are affected by this come for lunch, our practice manager, our senior nurse, our treatment or patient coordinator, I should say. So everyone came and basically were there to advocate their side to make sure it's really balanced. And I thought it was a really, really good afternoon. So yeah, it's been great. How was your week?
It was good. I completed the literature portion of the sedation course this week.
How did you sleep?
Well, I was very surprised by how good some of the online learning is and how much I'd had remembered from uni as well. So I'm very
good.
excited to do the practical bit now.
When does that happen?
Saturday. So
Okay.
yeah,
Oh, wow.
on the journey. So
Okay, great.
yeah,
So Monday, we're good to
put
go?
something in.
Fantastic. Good. Yeah.
So the voice you heard at the beginning was that of the fabulous Dr. Helen Rimmer. Helen graduated with honours from the University of Wales College of Dentistry after completing an undergraduate degree in biochemistry. After university, Helen went on to work as an associate dentist in mixed practice before buying her facial aesthetics clinic with her husband, Dr Sid. She has over 15 years experience in providing Botox, lip enhancement, dermal fillers and skin resurfacing treatments. She is a perfectionist and has a particular passion for creating lip contours and naturally full lip volumes for her clients. Within the clinic, she also provides private dental care and is highly experienced at providing comprehensive and complex orthodontic treatments. She has a special interest in restoring patient smiles and is an expert at achieving and surpassing the high expectations of her clients. Helen is also the other principal that I work for, and met Ali through her work with the IDAW together. And we are honoured to have her with her today to chat all things about mixing facial aesthetics with dentistry.
Oh, that was a spiel, wasn't it? Goodness me.
Did you write that, Helen?
So why did you want to be a dentist?
I didn't.
Fair enough. Why did you not want to be a dentist?
I tell you what, I wanted to be a marine biologist when I was a kid. And then people kept telling me the North Sea was really cold and dirty and it would be a rubbish career option. So I reevaluated and...
Are mouths less dirty?
No. And also I was like, I didn't have to work in the North Sea. I could have worked anywhere in the world. But I had a very nice dentist, so I thought maybe I could follow that route. So I kind of ran with that and then missed one of my A-levels and had no intention of repeating and staying at home any longer. So I went with option B, which was biochemistry. Did a biochemistry degree and that was really good actually, really enjoyable, but came to the conclusion that test tubes and mice probably weren't my preferred option. And went back to dentistry and then went back and did it again. So, and that's how I ended up getting there.
Wow.
You glad you did?
What, dentistry?
Yeah.
Yes.
Did you use much of the biochemistry in the dentistry degree?
You do. You cover what you in the first. You probably cover 60% of what you cover in the first year of biochemistry in dentistry. So that was a walk in the park.
I'd done that bit.
Yeah.
And you do physiology as well. So the only thing I hadn't touched on was the anatomy.
Oh, nice. I'm not gonna lie, I'm now just thinking about how I would love to actually read a paper on what is dirtier, a human mouth or the North Sea.
Mouth, I reckon. What do you reckon? Yeah.
Fair enough.
Yeah.
No one needs to study that then.
Well, I don't want to read a paper on it. I'm up for guessing.
How did you find then mixed practice sort of after uni?
So my VT was in a nice, not rural town, so it was in Caldecott, but not in the city kind of thing. And that was nice. I got to do a lot of dentures during VT, way more than I did at university anyway. So that was a learning curve. And then I came out of that and worked in Chepstow for 3 months, but it was a new NHS practice and they basically ran out of patients after 3 months and I was not enjoying the patient base that I had acquired.
Yeah.
And so looked for something new, ended up going over to Port Talbot then, so went in the other direction, worked in, there were sister practices, one was purely NHS and the other one was private, so worked predominantly in the NHS practice and did a Friday in the private practice. And off the back of one of the other dentists going on a couple of maternity leaves and some less fun experiences with alpha males, should we say?
Yeah.
Then ended up doing some other maternity leave covers and deciding that I wanted to pursue probably my own practice.
So you were thinking there are no practices where there aren't problems and I'd rather run things
No,
myself?
I worked in what 1, 2, 3, 4, 5, 6 different practices, and they were all very different practices as well. So I can't say I'd changed the journey, because I learned a lot about myself, about the dentistry I wanted to practice, about who I wanted to work with, what kind of dentistry I wanted to do. And so I couldn't have changed the journey, because that's how I got to where I went. But there was certainly a lot of steps along the way that taught me what I didn't want to do.
Yeah.
And then I actually ended up in Caerphilly eventually, down that way, and I worked there for a little while, but the timing over there was a little bit elongated before I got the offer of buying the practice, and I had already started Dermaskin by that point. And then when I saw the figures, they just didn't work. So
was Dermaskin a squat practice?
So Dermaskin started off as just facial aesthetics. We were working out of serviced offices. We started off in a spa that did a lot of colonics.
Were you doing any colonics?
No. That was different. And then we moved to serviced offices where we could work out there. And then my husband, because I was working with my husband, and we were doing it on top. So I was doing it outside of dentistry, and he was a GP. So he decided to bite the bullet and go try and do it full time, which he did. And then the business grew, basically. So then we started looking for premises to buy, which we found down the bay. And when we were renovating it, we had this conversation that there was enough space to put in a dental surgery. So should we do it? And I was like, do you know what? Let's put it in. Let's do it. So it's only a single chair. And then, like I said, by the time the offer of buying the practice came in, I was actually already pregnant and already had started that. And I just thought, that's not going to work. I'm going to lose money to be off. Yeah.
What point did you start doing any sort of facial aesthetics? Was it when you were doing the mixed practices? Or?
So in VT, I went to a CPD evening event with Bob Carner, who'd come all the way to Cardiff and did a talk about, so it must have been quite early in his career as well. And he came and did a couple of hours talk about it, and I thought, that looks interesting. Maybe there's something else. I like a bit of variety. And it must have been, I must have been going to the dentistry show or something. And I'd said to Sid, my husband, I was like, I think I'll go and book one of his courses. I've got a voucher or something like that for a bit of money off it. And he said, why don't you book me on it as well? I was like, okay, fine. And we duly went off to London, and he got measles during the day.
Oh my God.
Sorry, your husband or?
No, my husband got measles
on
the course. We were sat in this room, and they were re-tarring the roofs. This is in the Royal College of Surgeons, I think it was. And so they had the aircon on, and all you could smell was this tar coming into the room, which was pretty hideous. And we'd driven up at like 5 o'clock in the morning for it. And so I'm thinking, so I'm looking at him and going, Sid, you look a bit rough. And he was like, yeah, I've got a bit of headache actually. I'm like, okay, fine. And we carry on a bit later, and I'm like, you really look like crap, like in the nicest possible way. I was like, I don't think I've ever seen you look this ropey. And he was like, yeah, I do really feel not great. And then a little bit later, I'm like, you look a bit spotty.
What every husband wants to do.
And I was like, your eyes are really red. And he's like, I've got this cracking headache. And we're thinking it's these fumes. And it is like stinking. So he's like, look, can we turn off this aircon? Because this is hideous. So he turned it off. And we got up to lunchtime, and we were supposed to move the car because we knew we'd get a ticket. We had to move it because we were in a 4-hour zone or something. And he was like, I'm not walking. I can't do it. I'll get the ticket. And I was like, that's unusual. We were. And And I was like, do you want something to eat? And he's like, no, I can't eat. I'm just going to go and find a dark corner to sit in. And then I'd gone around and I was like, we were trying to find some paracetamol, and went up to the desk and was like, have you got any paracetamol? And the security guard was like, no, we haven't got any medication here. And one of the, must have been like the board directors, was walking behind, and he came back and he said, I'm sorry, did you just say we don't have any medication in the building? And the guy's like, yeah, we don't have anything. And he was like, are you telling me the Royal College of Surgeons, if there's an emergency outside and a member of the public tries to come in here to ask for help, we have nothing to help them with? And he was like, yeah, we don't have anything.
Oh my God, wow.
So I think that swiftly changed off the back of that. Unfortunately, some female doctor was walking past and she was like, well, I've got some paracetamol in my handbag. So I had that. And he went off into the toilets and he came back and he said, I have got a rash everywhere. And he was like, can you have a look in my mouth and see if I've got spots? And I'm like, yeah, you do, actually. And he's like, I think I've got measles.
Oh, wow.
And he did. But at the time, so he grew up in the Middle East, and clearly he'd had the separate MMR jabs, but obviously not one of the M's. But he didn't know.
Right. Okay.
And his mum was like, yeah, you had everything that was available. But she didn't know either, and he had no records. And then he'd been working in peds.
Oh, wow.
And had come into contact with a measles case. And then I ended up having to take him to High Wycombe Hospital.
And sorry, you still support Djokovic's stance on all of this?
No, I firmly believe in childhood inoculations.
Okay,
I am
okay,
just
I'm
not that
just
fussed
confirming.
on like new, untested with big pharma behind it.
Fair.
And also, still, it's your choice. I do believe in your choice. I don't believe in mandated stuff.
Except for ped stuff.
Well, again, there's still choice. Nobody is forced to give their child vaccinations. Hence, that's why we have outbreaks of things like measles.
Okay.
We don't mandate that.
To be fair, I had the MMR, and my year group, it's not the best one because I ended up with mumps. And when I went to the doctor, they said, they were like, looked at the year and they were like, yes, there's a lot of them from that year.
Oh, it was that year.
It's not
1983 was a big year for it because there was loads in my year that didn't have it.
Yeah.
And all the boys were coming out in big cheeks.
I looked like a hamster. It was not good. It was a very fun New Year's.
I grew up in Kenya, I had solid
like, whatever,
vaccinations. It was great. Yeah, I think I got the good stuff.
Fair enough. So, other than the measles on the course, did you
so
learn
let me
a
go
lot about
back to
facial
that.
aesthetics?
So we did that, and then we started off. God, how did we get into it? We did a Botox party
Oh, nice.
for strippers, and in their house. And it was the first and last Botox party we ever ran because it was difficult. It's very
Herding
difficult.
cats.
Herding cats and dogs with alcohol is not a good mix. So we're like, yeah, that's not going to work. Got great bunch of clients, I have to say. Cracking bunch of girls, but we're like, this is not what we're going to do. We've got to do this in controlled environment. That's not going to happen again. So then that's when we started looking for a premises to work out of. Yeah, so I didn't do it in any of the dental practices.
Mm-mm.
No, ever. I don't think I ever did it in any of them. Just only did it in our own places where we were working.
Do you consider Dermaskin a dental practice?
No, it's a facial aesthetics practice that
offers some
happens to have
dental.
a dentist in it. Yeah.
Okay.
Yeah, it's totally the other way around.
And it's always how you guys have thought about it. It's been
Yeah.
branded as such. It's always been marketed as such, represented. Yeah.
Yes, yeah. We know it was always people ask us about, or me about it, and because I'm a dentist, I get asked about it, and it just happened to be they were like, well, we could offer it as an extra service to our facial aesthetic clients, not that it's a dental practice. Yeah.
So what then, because obviously Flo works at both of our practices, and that was a change, right? This has been the first person who's come in to do dental. So what changed? Was it that you were getting too busy, or that you had a change of strategy or direction?
So I changed my hours over probably COVID-y time, I think. I used to, certainly when the kids were very small, I used to work quite long hours. I used to try and come home after they'd fallen asleep. And then over COVID, I changed things around, and a couple of things happened with like their school bus and stuff. So I ended up doing the school run. So I work mornings now. So basically work in the school time, which meant I had there was more standardised empty chair time. So I operate across 2 rooms. So I used to have empty chair time, but it was not because I was in another room doing something else, whereas it was guaranteed certain times of the day. And then I'd changed around my hours. So, and I thought, and when you just happened to put up a message, and I thought, well, why not? Second pair of hands might be useful.
Yeah.
And maybe we can try and grow that side of the business a bit more. Not being particularly successful, but you know. I used to think, so I always knew facial aesthetics off the back of dentistry is a really hard sell.
Yeah.
People are not in the mindset for it. It's really difficult to try and push that onto dental patients. And I thought it was easier the other way round. But because I'd never tried to push it, it just had organically grown off over the years, and I was always busy doing other stuff, so I didn't really notice it. And it was not until I've tried to push it that I've thought, actually, it doesn't work the other way around particularly well either.
It's just, do you think it's just 2 very different fields?
Yeah, because it's very different fields, different mindsets. I think people almost don't want to combine the 2 because they are often I think even the most comfortable patient is a little bit nervous of the dentist, of what's going to be found when you have a look inside. And almost the facial aesthetics is more of a, you know, some people might argue it's a necessity, but it's not going to affect your health. And I think so they like it as being more of a pampering sort of, it's a nicer side. And I don't think the twain meet very well, that some of them are happy with it, but most people seem to like to keep them totally separate.
So if you were sort of a dentist then wanting to do facial aesthetics, would you recommend sort of, you know, doing a course and then trying to get somewhere sort of more in a facial aesthetics clinic then, rather than trying to sell it at all to your patients?
I think you can try and sell it to your patients. I just don't expect a huge positive feedback mechanism. There will be some people that will take it on for the convenience of killing 2 birds sort of at the same time. And you've got the sort of dental aspects and the TMJ dysfunction stuff that you can use it with. But I think if you really, really want to, I don't know anyone who's persevered with it and done very well in-house. They all tend to take it out of house and roll with it in a separate location.
What was the hardest thing about sort of setting up that aesthetics clinic?
Finding a place, finding a location. Yeah.
Why? What kind of things? What boxes were you trying to tick that were difficult?
So we wanted somewhere that was big enough. The same as a dental practice, I have to say, quite similar. Somewhere big enough, somewhere with parking, somewhere that sat in our location sort of area that we'd already been operating in, so it had to be close by because people were used to going there. We knew they weren't going to suddenly come to the other side of Cardiff. And something that gave you an element of privacy as well, because a lot of people like to keep to themselves, that sort of thing. So it would be much better than not walking out into the middle of the town centre where friends, family and people might be walking by. So it had to kind of fit that remit as well. And there just wasn't much on the market when we were looking, and then thankfully this one place came up that fitted the bill. And then it was bought.
Do you find that within the building there's an element of trying to keep people private as well? Do you find that actually there's one waiting room and it's fine?
One waiting room and it's fine.
Okay, so once they're in the building,
they're all right. Yeah.
Okay.
Yeah.
Well, I suppose everyone knows where everyone else is there.
Yeah.
Oh yeah, like if you've signed up to it, it's fine. Yeah.
Can I ask? It's so you've kind of brought someone in, and there wasn't. So your list wasn't really over spilling.
No.
So it was kind of maybe. Was there an element of? I'm asking this in front of Flo. Was it because it was Flo? Did it matter that it's another woman in dentistry? Because these are important kind of themes that we've been looking at, and you're what we consider an inspirational woman in dentistry. No, it's amazing.
I'm not really sure why, but okay.
I will go through reasons why. I think it's really important actually because, well, let's talk about this first, and then I think when we talk about IDAW, it will make sense. But did it matter that it was Flo?
So I didn't know Flo. Obviously, I didn't know Flo, so I can't say it was Flo that sparked the idea.
Yeah.
I didn't know Flo.
Okay.
So it was. I think I'd and ahed about an associate a few times, and then of course you start looking at vicarious liability and things like that, and then I'd already backed away from it because I've made such a niche, strange bubble of these sort of really loyal patients and I know they and with the facial aesthetics, it's almost like it's a bit like a cult, once they buy into you as the person, that's who they're seeing. End of story.
Right.
So I knew if I brought anyone in, it would have to be someone pretty special to work with that. We already have sort of 2 nurses, RGN nurses, that work for us doing the facial aesthetic stuff, and then they've built up their own little cults as well. And it was all in-house training as well, so everybody works in a very similar way. And then with the dentistry, I had always thought it would be a good idea to have a second pair of hands, just for holiday cover and things like that, there's somebody else around. And then when you mentioned that you had Flo as a mentee and you'd really enjoyed having her there, and that she was a particularly unique human in a good way.
That was the strangest way to phrase that as a compliment.
as in like somebody who'd really, really been happy to learn, and which I think is really important with a young dentist, that they're actually happy to take on board. Not that you just tell them what to do and they do it, but they appreciate that you've got some experience there, and they will want to do stuff in their own way, but they take on board. And when you say that you've made these mistakes, they don't have to go through them themselves. They actually go, okay, I'll just learn from that.
Yeah, absolutely.
And I know
being teachable is such an asset that people don't always consider, but also you're letting someone into, this is your baby that you've built from the scratch, and someone needs to be open to how to do
being
things.
Moldable, but with a confidence that they also don't need their hand holding all the time, because I knew I wasn't going to be able to do that. I'm not I can teach, but you have to do it as well, just to get on with it. So because that's how you'd sold it in a way.
Okay.
That's how it had come across to me. And I thought, do you know what, if Ali's sat with her and worked with her,
I'm difficult on this as well, so totally,
then there's a chance that might work there. But and then I invited you in, and I was quite open and honest about how it was going to roll, and and if you want to give it a try, but I'm going to make no promises at all.
Actually, this is important to say, because there's young dentists listening to this, and they're looking for the perfect opportunity, and a lot of the perfect opportunity comes from being the right person for that opportunity and being open to learning, but also knowing that we when we're practice owners and we're letting someone in, it's a big thing. And also when you're looking for the right job, someone putting their cards on the table, like we see all these ads go up with private potential, and it's the same stuff over and over again. I mean, really, someone's going to back you if they're going to put their cards on the table at the beginning. And it's an interesting discussion to have, because it's a rare circumstance where 3 people are talking in this situation. So
I'm not gonna lie, I sounded a bit like a pet.
She lived in my house for a while, and she was very easy to take care of.
How strange.
But actually, Flo, I think it's testament to the fact that you're carrying out such. I mean, this isn't really, it's about you, but it's not about you, because what people are going to take away from this is about them and their journeys. And you've come into two very different practices, very different people, very different philosophies, very different clinical work being carried out, and I think the thing that Helen touched on that I've been through the same in my career is maybe working at the wrong places, but working at lots of places is really important. And working at lots of places gives you an idea. And the fact that you've been able, the places you've enjoyed working or you've stayed on are very different places, says a lot about your adaptability. And the fact is, everyone can't walk out and go to their perfect practice with no experience and no build up to there, right? So yeah, it's being willing to put in and go, you're willing to take a chance on me, I'll take a chance on your project. Because working with a business on their projects is what's going to make it a win-win and worth everyone trying it out. So yeah.
Oh, no, definitely. Well, I thoroughly enjoy working for both of you.
You have to say that, but that's cool.
Throw that out there. So what do you think makes a really good aesthetics practitioner?
Kind of what makes a good dentist. I think you've got to be really personable. You've got to be able to build rapport with people quickly. You've got to be able to read the room very quickly as well. You need to, and sort of that reading the person is understanding their wants quite early on. So you have to ask the right questions. You have to be a bit of a detective to ask the right questions, see where they're going and feel them out as to, much like with dentistry, is sometimes you know you're not getting the real answer or the right answer. And then you've got to have really good attention to detail. These are the same sort of patients as high-end aesthetic dental patients. They will point to the smallest thing and you have to be able to see it. And if you're not that kind of person, it's don't do it. And also, someone said to me once that they'd started doing it and stopped because what they really didn't like was they didn't see the finished product often. And they really hated that, because when it's not finished in your room, it's going to finish at home in a few weeks. And if you've done it really well, you won't see them again until they come back and need it doing again. And they're like, what you did last time?
To calibrate.
Do that again.
Yeah.
You're like, oh, okay. So I know some people hate that, especially as a dentist where you normally get to see your work finished. They really dislike that feeling of not knowing what they've done.
Yeah.
But I think that's really it, is attention to detail and having a good rapport with people. Yeah.
Where do you think most people sort of fail a little bit with it?
That it gets sold on a lot of courses as a money-making scheme. And if you only see one patient a day or 3 patients a week, you'll suddenly make all this money. But they don't tell you where you're going to find those patients every day, every week. And these would all be new patients and return. And, they're only going to come back every 3, 4, 6, 12 months. And so actually at the start, you'll probably be doing it on your friends and family, and you'll be lucky if you're covering the costs of things. And you probably are going to make a loss because you're going to make your mistakes and you're going to have to clear them up. And then they're like, oh no, actually, I don't like this because I was sold that. And it's absolute nonsense. And now it's a really saturated market. I'm coming up on sort of 15, 20 years of this, and it was not quite so saturated, but it was also not quite as big as it is now. But now it's really saturated. It's really hard to get into.
So how do you stand out if you're getting into it?
I don't know.
Yeah. No, it's fair. You don't need to do that now.
I don't know. I don't know how you would do it again. I mean, we just worked really hard.
Yeah.
And at the beginning, we didn't advertise. Ours was all word of mouth, and that's the best way of getting clients is people recommending you, and then just keeping up a really good service.
So when you say you worked really hard, Does that mean like the time and attention you put into each case to make sure these people are going out there and singing your praises?
Yeah, but also being there, because the other thing was, so when Sid's, so we you know, when we first started, we were trying to answer phone calls in the middle of surgery to book a patient in for the weekend and things like that, or after work. And as that grew a little bit, we're like, that's not feasible.
Yeah.
Which is why he, like Sid, made the decision to go full time. So that, and he was his own secretary at the beginning.
Did he use different voices?
Yeah.
I can definitely see Sid doing that.
That was the thing. But he did it full time.
Yeah.
So if they wanted to come in, there was availability. If they wanted to come in late nights, there was availability. I was doing weekends, so there was availability. And we did that consistently. We weren't like, well, you can only come at 4 on a Tuesday.
Yeah.
That's it.
So are you tied to that availability now?
Yes and no. We've changed it a little bit over the years. And we have, so our patient base is predominantly sort of 35, 40 plus. We are the more mature end of the market, because we price ourselves out of the very young market because they're very price sensitive. So fortunately, our cohort tends to like, as long as we've got a range of appointments, we can house them.
Yeah.
But we do cover pretty much almost 6 days a week, fairly regularly. But we stopped doing our very late nights over COVID. That was the end of them. So we used to work up to sort of 7:30, 8 o'clock, and we just said enough's enough.
Yeah.
If you've got weekends or you've got weekdays, there must be somewhere you can come in. Yeah.
No, definitely. I think that's been nice as well, like working with more of the patients, and that whole word of mouth that you were saying, like most people coming in are like, oh, I heard it from this person, they loved this and this, and there is I think a real community feel to a lot of that patient base, and they all really like the service that you get there. And they are a lot of them do work, and it's that classic that I'm just on my lunch break and I'm running in for it.
Well, it is, look at, and the kind of treatments that you do, it's not like dentistry that, I mean, there is some dental treatments that you can do quickly in a lunch break, but most people don't want to be doing that in the middle of work and you've got a numb face, and whereas a lot of facial aesthetic stuff generally can be quite quick and in and out. But they also, because they see it as a pamper, they're happy to do it on a day off when they take time off to go to the hairdressers and things. It's like it is a different
nice thing.
Yeah.
Yeah.
They look forward to it.
Yeah.
What's your favourite sort of facial aesthetics treatment to do?
Wonky faces. I don't know how to put that in a nice way. Asymmetrical faces, and trying to make them more symmetrical. Yes.
Why are you looking at me like that?
I'm just
Is there any courses you would recommend to someone sort of just going into it?
I mean, I haven't been on these courses. Some of the courses I went on don't even run anymore. So I would go on anything that has got reasonable feedback off people and gives you a basis. But you're never going to learn it all from a course. It's as simple as that. Anybody who makes a lot of courses to teach this stuff is probably padding out the book a little bit. So, yeah, right, you probably don't want to learn it all in one day necessarily, but you also don't need to go back and do 25 courses because there's going to be an awful lot of repetition in there. But do one, get some basics in, try it on a few friends and family members, and if you like it, go back and do another bit of a course. They still haven't I know they talk about legislation changing and bringing in these level 7s, and I can't, it's spoken about. I still don't see it becoming the law anytime soon. But ultimately, and now, you know, we have YouTube and Google, and there's so much stuff on there that you can watch and try it.
How important do you think mentorship is in this? Do you think it really protects people, having people experienced around you?
It really helps if you can. So, for instance, I mean, like Flo's walked in and she's already done quite a lot of it, but she could ask questions if she wanted to. The two, so like for instance, like the two nurses that came, they trained in house, so they shadowed myself and Sid for weeks, and so they got full training in house, saw stuff. I think if you could do that level of mentorship, where you're actually in the room with someone, watching what they're doing, seeing lots of different people, different faces, different techniques, that's amazing. If you've got someone on hand to help you with stuff. But I really struggle with the hard and fast rules that they put into courses. Like, you can't inject in this area and you must inject there and you must do it this way. And I'm like, it's a face. In as much as you say about, you can't say every tooth has to be treated in exactly the same manner, because they're not all the same. Like, biology across the board is not the same. And that's, you'll only pick up this stuff as you see more people, treat more people.
I found it fascinating when you were telling me about the infections making the filler in the cheeks harden up as well.
Yeah.
The
Spreading infections. We've noticed that anecdotally, that often sort of not initial placement, sort of down the line, some people going, oh, I've like coming in and they've almost got like, feels like capsulation of the filler. And if you ask them, probe them about it, they all seem to have very recently had a dental infection. We've kind of noticed a correlation there.
Cool, okay.
And not even necessarily ones that would be classed as a spreading infection, needing antibiotics.
Wow, okay.
Which makes me think things spread
more than we
like to talk, than we reckon it does.
Yeah, that's really interesting. And that's things that you only really see. So this is the problem with, if you're doing one treatment a week, you won't see these patterns. These are things that people doing things full time are seeing, basically. It's really interesting.
How did you find like building that like good core team as well for the practice?
Slow. Simple as that. So it started off with me and Sid. We had a couple of, then we had to get sort of some admin side. They joined the team. They've come and gone over the years. Jen was the first nurse that we took on, and so I'd already taken on Lauren, actually. So Lauren was the first person I took on, because obviously I'd started up the dentistry side of it, and Lauren was a nurse that I'd worked for in Caerphilly, who had moved to another practice, and I kind of poached her back because she was so lovely to work for or with. And then Jen was one of her friends who had finished her nursing degree, got into nursing, but was really interested in facial aesthetics and really wanted to move into it. So we spoke to her and she was really keen to come in, so she started. Tiffany, who was our other nurse, I can't even remember how, but she started off as one of our receptionists. And then she went back and did a nursing degree, and she was still working for us as a receptionist. And then when she came out, then we trained her up.
Cool.
Jordan, I don't even remember how I found Jordan. I think she must have just applied for a job interview. You just meet Jordan. She's awesome.
Yeah. I think everyone will have heard the episode with Jordan by the time this comes out. Yeah.
So then it's just been a slow burn, and once you find the right people, I do feel they tend to stick. I did an EQ course with Ian and Paddy, and it was a little bit, some stuff that you really should know, but it just made it really obvious. And a lot of that I was doing it with another dental practice, and the dentist that runs another small one, so she's just started a new practice, and she is, I can't say I know her dental work, but I'm assuming she's an awesome dentist, but she's an awesome person. But she's so opposite from me. as in spade is a spade over here, and she is flamboyant and arty and, you know, theatrical. And it wasn't until he was sort of pointing out that you will employ people that are quite like you. And you're like, well, obviously you want to employ people that you get on with, but it was so apparent looking around the room that you could just guess who would be working for me and who would be working for her. And I had sat there and thought,
I need a Jordan.
well, no, Jordan was in the room with me at that point, but I was looking at her, I think because I was looking at her stuff thinking, nice girls would not work in our practice. And it wasn't until he said it that I was like, oh my God, yeah, because they're not like me at all. Yeah, and it was little bit of a like, oh yeah, that really is a thing.
So because we had it was our first growth day. We had personality testing, and we had a bunch of, I'd say pinch points in the practice, and things that weren't going how we wanted them to, and it's because of exactly the same thing. And actually, we found that in personality testing, that the people we thought weren't filling their roles well, whereas because we were expected to fill their roles as I would, and that we had recruited according to our personalities. And so our recruitment changed according to this. And so we started recruiting according to which balance we needed. So we knew the balance of the team. And I'd say now we have a really well-rounded team, but we have such a weird mix of people. And they won't mind me saying this. We're all the thing is, we're all the same amount of weird, so it works. But yeah, I think it's so important that this like self-realization and then planning around it. And you don't have to go to the extremes, you know. You don't have to have someone who just communicates by interpretive dance, for example. But there's
but it will be that in as much as you've got your strengths and your weaknesses across the team, you will all be a similar sort of set of human beings.
Yeah. And you need some similarities for everyone to kind of survive together. But our Venn diagrams now kind of overlap like Olympic rings rather than all around one center. But yeah, that's really interesting. That I think it's really important, these courses that people go to where you think they're just stating the obvious, but isn't that the best teaching you'll ever have, where someone tells you something? I have to say, but I went on Rob Moretti's soft tissue course, and when I left his course, I was like, people would say this guy's the best educator you'll ever meet, and you need to go see him before he retires. And I went, and it was an expensive course. It was a cadaver course. It was 2 days. It was intensive. I was like, I don't think I learned anything, and I went away from it going, what was the big deal? And a few days later, I realized that he changed the way I think, which is crazy, but just through really small, obvious connections, telling a story. And I messaged Rob and I said, Rob, that course was probably the best course I've ever been on. And it snuck up on me. And I think that's amazing. So it's a really big thing to go on courses that you might think are obvious things. I already know how to communicate and I'm fine, because you never know what you'll come out with.
Yeah.
That's very true. So you guys met through IDAW, is that right?
Yes.
Yeah.
Yeah, I was in that, yeah.
I don't really know how it all happened, to be honest. And I know Helen now, and I feel like I've worked with her on projects. And I feel like when we're making a list of inspirational women, Helen's on that list, but I don't know how it started.
Twittergate.
Okay. Let's not go into that.
But that's where I arrived to the party, was Twittergate. Because I have no knowledge of what came before that.
So during COVID, there was, in Wales at least, it felt like private dental practice had no representation, and a group of people came together. And I might be wrong here, but one of the things we were trying to, it wasn't me that started this, but at one point we were just trying to get together as many like-minded practice owners as possible to think through this, to brainstorm. And I think Charlene said Helen needs to be in on this. I believe.
Yeah, it was
that was
Charlene asked me to. Did I have a Twitter account?
I was like, you were brought in as the person on Twitter
like, I need your help. Do you have a Twitter account? I'm like, I might have one, but I don't think I've ever used it. She's like, well, you will today.
Brilliant. And just for anyone listening, I mean, basically it was, we needed to get information out there, and we need to get people tagged who had any influence, and just to bring awareness to the situation that we were going to a point where we were going to just be giving everyone a prescription and doing teledentistry.
Well, I think it was there was something around the CDO had made a tweet about dental practices in Wales remaining open.
Yeah.
And that's what had all kicked it off.
Yeah.
And it was that England had been forced to, I think, close entirely, like shut your door, whereas she'd left it open for us, but with the massive caveat of you couldn't actually do anything. But you could write a script and you couldn't pick up a handpiece.
Yes.
And so it was, and somebody, then it had all very much, as Twitter does, deteriorated, because in your 15 characters you can't possibly make a coherent sentence. And it had all got really nasty. And then there was a lot of talk of gaslighting and GDP reporting and all sorts of things going on.
But I guess, sorry, just to bring it back to that, because I was an associate at the time, I didn't have a practice, and I didn't realize the significance. If the chief dental officer says dental practices remain open, but private practices are not allowed to carry out any dentistry, everyone's insurance is void for filling any loss of income. And the danger was that a lot of practices that don't have NHS funding, and that's, I think at the time we calculated about 80 purely private practices in Wales.
Yeah, it's not
were in danger.
A huge amount, but when it's an open-ended, you've got to remain open and provide a service, but you're going to get absolutely no money for it.
Yeah, and what you have to remember is, think about the amount of burden that these 80 practices take off of a failing system with no funding. And it was just a very, it felt like a very, they were having their cake and eating it too in that move. And that's when a few of us came together. And what you were saying, well, I don't know why I'm inspirational. You're inspirational because you stand up for what you believe in. Like, even today, it would have been easy to ignore the Djokovic jibes, right? But no, but this is the point. Like, there are lots of people in dentistry who won't speak their minds. And I think there's a lot of us who started on IDAW who don't think the same and don't agree on a lot of things, but we respect everyone's ability to voice their opinions and accept other people's opinions. And I think that's inspirational. And were very few women on this committee. There was you, there was Charlene. Am I missing anyone? Francis started with us.
Francis, Gwenna, dental care.
Yes, Anna was there. And then Laurie, yeah. I mean, and to be fair, everyone has been excellent and done their part, but one of the issues, and we've had lots of guests as part of this series on inspirational women who we've talked to about committee representation and bigger picture in dentistry, and more women standing up and just speaking their mind, because honestly, that's all a committee is. Someone, you give your opinion and it might be valuable and it might not, it might influence things, but this is why we need more people like Helen who speak their minds, and that's really important. And actually, the other thing about you that you came into the practice, I don't think you realize how much you changed the way we work, but Helen came into the practice one day and said, you'd come in to drop something off.
Yeah. It was actually. Yeah.
And you walked in, you're like, oh, this is a nice place. This is what you should do. You should have it so that you take photos of every patient, you show them the photos and you communicate like this. And so we went, okay. And we started doing it and things changed. And there's a lot of modesty in the way you run your practice, the way you do your clinical work. But I had a suspicion that you have a lot more in-depth understanding of patient workflows and clinical work than you let on, or than it's just humility. And through Flow, that has been confirmed. And so one of the things is, I mean, have you ever thought, I'm putting you on the spot here, but what you talked about, the way you trained the nurses in-house, have you thought about maybe that you should be in education and be setting up clinical residencies where you're teaching people, and that your style of teaching, where you're like sink or swim, is actually exactly what's missing from dental education?
It's not something that's appealed to me.
I don't want to do it.
No, I mean, I just don't have the time. The long and short of it is, I was like, I don't have any time.
Yeah.
I'm not. Hats off to people who teach. I think the lady you had on this last week, and she's just started teaching, the Scottish lady.
Yeah, Leanne. Yeah.
and she was saying something about the adage of those who can do, those who can't. And I do think it's those who can't teach exclusively.
Fair.
Because I am hats off to people like yourself who teach and still work in practice, in busy practices, doing high-end work, because I just don't see where you squeeze it in.
Well, also you're a mum, and this is one of the other
You're a dad.
themes. Yeah, there is a.
I mean, there is a difference.
There is just more
but
pressure on mums. There just is, and this is the issue. I mean, I don't know why I'm arguing with you two about this, but you know, I mean,
Classic mansplaining.
Yeah.
Issues of women.
Yeah, I mean, the issue for me of seeing committees with that are just men and organizations that are just men, and there being a lack of representation is because the best people just don't have time, you know, and that's not
just
it's not your
time. You
fault.
don't want to. I mean, I really loved that meeting we had where a bunch of alpha males told me as a female that the only contribution I could give would be to recruit more females because they were struggling and they didn't know why.
I just want to say that wasn't me.
Well, you were at that meeting, but it was not you.
Yeah.
And then you go, why would I want to be in
Yeah.
a committee with people like that?
Yeah. But that's why people like you should be running committees. But my point being, a lot of the women we've had on as part of this inspirational series are really inspirational. You know, you talk about things that people just go, oh wow, which are just you're casually mentioning, and it's just a note to say like I've gotten to know you over the last few years, and exposure to you has changed people. You look at Flo, there's plenty of people. There's a lot of the female dentists that are friends of yours and colleagues of yours who look to you for a lot of things. And you don't, I know you don't really think about it, but it was just to say that actually that's something to maybe consider, because otherwise it will be the same old boys recruiting women to recruit women so that the numbers look better. That's all I wanted to say.
Well, I have thoroughly enjoyed this chat. But before you go, we have the dental quickfire quiz that we ask all our guests to enter you to earn your dental pearl. It is purely virtual.
Terms and conditions.
Yeah. So, which is your favourite procedure to do?
Is this dental?
It could be dental or facial aesthetics.
I have to go back to my asymmetrical face then.
Fair enough.
I do love that. Yeah.
What's your favourite scrub colour to wear?
I'm quite liking our teal at the moment.
It is a very nice colour. With no context, which is your favourite tooth?
Quite partial to a lateral, an upper lateral.
Mm-hmm. A side?
I find left is always more tricky than right. But
That upper left too. And if you were just leaving school now, what would you want to do?
That's really, I don't know.
A marine biologist?
Probably not. I think if I...
Military.
Oh no, I'd never work in the military. Oh, couldn't you imagine being told what to do?
I imagined you being the one telling people what to
Yes,
do.
but in order to achieve that rank,
Yeah.
you're going to have been told what to do a lot of the time. They wouldn't keep me in it. I'd be out. Jeez. I think if I was doing it all again, I probably would look more at economics, business, politics, things like that, instead of, because I went straight into sciences because that was the route. But I do not like the way the system just tries to make you into an NHS dentist.
Mm.
Helen, you're making my point for me because people like you should be training dentists. I just thought I'd throw that in there as well. So no.
Yeah. So I would have, I probably wouldn't do dentistry again, but I wouldn't change the path that I have done to get to this point.
Amazing. Well, thank you so much. And yeah.
Well,
Thank you, Helen.
Thank you.
You are inspirational, and I think there are more gems in this episode than you will realize to help people on their path. So thank you.
Hope so.
Ali, why did you invest in the Navident dynamic navigation system?
It's incredible. It brings our safety and accuracy up for patients. Here's a tracker that we use, and thanks to Rob from the Dental Imaging Company, it's been great support and so easy to set up. I see why so many people go to him for their digital imaging, 3D or 2-dimensional. and also all their surgical supplies like Ustermed screws. Rob's been incredible, and I'd highly recommend working with him.
Ali, can you name everything in the practice that's made by W&H?
Ooh, off the top of my head, all of our handpieces, our sterilization equipment, my implant motor, the Piezomed, they're an incredible company to work with because they're an Austrian company that focus on hygiene, and we know from studies that patients care most about hygiene. To top it all off, the support we get from them is amazing. They don't actually supply the equipment, but they provide the support. Now that's true support. Crown Dental burrs have a rota system, and what that means is I have the same burr box every time with the same burrs numbered. I ask my nurse for the number of burr rather than having to remember the name of it. And it also means that when I need a new burr, we go to the box which has this card, and if we are running out, my nurse can just scan the QR code and order the same one. So we never have problems with inconsistencies with burr boxes or burrs. Thank you very much for implementing this for me, Paul. I love it. And the other thing I love is that Paul's a problem solver. So I worked with him to curate this alveoplasty set, which he has such great knowledge for all of his burrs. And it means that we have everything we need for full arch surgery. So whether you have a problem with your set and need this set, or you have a problem that you need help solving, Crown Dental burrs will help you do it.